Om Dhanvantri Namaha, Shri Gurubhyo Namaha. Namaste and a very warm welcome to webinar series on Ayurveda practice organized by Ayuryana. I am Dr. Radha Chetana, co-founder of Ayuryana. I heartily welcome you, our distinguished guest speaker, Dr. Arun G. Nair, and all audience to today's session. Ayuryana is a platform offers a unique blend of health-focused educational activities and sustainable tourism. It's inspired by timeless principles of Ayurveda, thread morals, cultural and traditional values into every experience, creating a rich tapestry of heritage and wellness. Now, I would like to brief about webinar. Webinar series on Ayurveda practice is a free webinar series. The motto is to empower the Ayurveda fraternity to excel in clinical practice and sustainability through innovative approaches in Ayurveda entrepreneurship. Don't forget to like, share, and subscribe the channel. Today's topic is Practice of Sneha, Bridging Wellness and Therapeutics in Ayurveda by Dr. Arun G. Nair. Sir is from Kerala, completed UG from Bapuji Ayurveda Medical College, Chellakere, and PG in Kaya Chikitsa from Dhanvantri Ayurveda Medical College, Siddhapura. Currently working as Assistant Professor in Department of Kaya Chikitsa at Atreya Ayurveda Medical College and Hospital, Doddaballapura, Bengaluru. He is a dedicated and knowledgeable Ayurvedic physician with over 3 years of clinical experience, specializing in the management of metabolic and endocrine disorders, spine disorders, skin care, and infertility. Offers patient centric treatment grounded in authentic Ayurvedic principles, complemented by tailored diet and exercise regimens. I once again welcome you, sir, and the mic is yours.
Good evening. Namaste, one and all. So, firstly, I would like to extend my warm regards to Team Ayuryana for such a wonderful platform. So, without wasting any more time, we will directly move into the topic. So, today's topic it is practice of Snehana, bridging wellness and therapeutics in Ayurveda. So, as you all know, Snehana, it is mentioned on among the Purva Karmas in Panchakarma. So, but even though it is mentioned as a Purva Karma, it is having very wonderful effects on clinical practice if it is properly used. So, we'll dwell into the matter a little bit deeper. To start with, so first, regarding the basics of the Snehanas, most of you are aware about what is Snehana. So Acharya Charaka explains it with a slogan. Snehanam, Sneha Vishyantam, Mardavam, Kledakaragam. So Sneha, it can be considered as any dravya which will be uh, providing the following properties. That is, it will do Vishyandana, Mardavata, and it will be the Kleda Karaka, or it will be a reason for Kleda Janana. Okay, so Mardavada here specifically it is related to the Twak Mardavada. Okay, so there are different number of Sneha Dravyas explained by different acharyas in different contexts. So mainly there are four different Sneha Dravyas. So that is Sarpi, Vasa, Majja, and Taila. So each one of them can be used in different conditions and in different quantities pertaining to the patient requisition. Okay. So here among these four, the most commonly used and most easily available Sneha is your Grita or Sarpi. So among these, all these four Sneha Dravyas, even though it is having so many medicinal properties, Sarpi or Grita stands separately. Why? It is having a peculiar quality called as Samskarasya Anuvartanat. So that makes it suitable for use starting from infant to elder people in different contexts. Okay. So in this webinar, even though the topic is practice of Snehana, we'll be more in detail. We'll be seeing about the use of Grita in healthy individuals as well as the diseased and how it can be utilized to its maximum benefits. So, and even we will be discussing some of the clinical cases with examples how practice of Snehana or practice of Grita Pana has improved the conditions vastly. Okay, so directly we will move into the session. So regarding Grita, even though I told all the four Sneha Dravyas, each of them are having different qualities, and each of them can be used for mitigating different doshas based on its properties. So, regarding to the since Grita is our major topic or major topic of interest today, we will be seeing exclusively about the Grita. Okay. So, coming to the properties or gunas of Grita, Acharya Charaka has given a sloka where he explains in general what and all Grita can do, or what and all are the gunas which Grita will incorporate into an individual if it is used. Okay. So if you notice the sloga, it is like next slide. No? So it is like Smriti, Buddhi, Agni, Shukra, Ojaha, Kapha, Medo, Vivardhanam, Vada, Pitta, Visha, Unmada, Shosha, Alakshmi, Jwarapaham, Sarva, Sneho, Uttamam, Sheetam, Maduram, Rasa, Pagayoho, Sahasra, Viryam, Vidir, Vidhibhir Gritam Karma Sahasrakrit. So here it is a, even though it is a very small sloka, it incorporates everything, every detail regarding the Grita. Why it is used, where and all it can be used, what and all benefits it provides, and why it is considered as Uttama Sneha. Okay. So if you notice the first line, there he explains about it, what and all it will increase or it will improve in a patient if used. Okay. So that is Smriti. It can enhance the or boost your memory, Buddhi, intelligence, Agni, Shukra, Ojas, Kapha, and Medo Dhatu. So here our point of interest in case of major, mainly in case of let it be any diseases. So our point of interest will be the third quality, what it is does. That is Smriti, Buddhi, and Agni. So, okay, so it will be, Grita will be, if it is used properly, it can be used to enhance your Agni. Okay, along with that, even Shukra, Meda, Adi Dadus also it will improve. Okay, and next line he explains about in which and all diseases or clinical conditions where you can be using or you will be able to give results with the proper usage of Grita. Okay, so in almost, so it is always told like Gritam Pitta Anilaharam. So it is always, it will be reducing your Pitta dosha as well as the Anila or Vada dosha. So same thing, Vada Pitta, that is Vada Pitta Vyadis, Visha, Unmada, Shosha. Why Shosha? That is again a beautiful context he says. Okay, so Shosha, even Grita, it is Agni Deeptikaraka and it will be improving the Medas also. Okay, along with that, it is even having Brahmana property. So that Brahmana property can be utilized efficiently if the drug of choice will be proper according to the patient in case of Shosha. Okay, and even Jwara, it can be mentioned. So in next line, so among all the four snehas, Grita is considered to be Uttama. So for that, it is having a quality called as Samskarasya Anuvardhana that we discussed earlier, right? So here he says, Sarva Sneha Uttamam. So Grita is considered to be the Uttama Sneha among all the four types of Sneha. Okay. So why? It is having Shida Virya, Madhura Vipaka. Okay. And it will be having Sahasra Viryam Vidibir Gritam Karma Sahasra Krit. So if it is properly utilized, it can be providing you with thousands of different karmas or different functions. Okay. So that is why Grita can be utilized, as I told earlier, from the infancy till elder people. Okay. How it can be utilized, we will be discussing in the further slides. So just to rewind, there is how Sneha is classified. Okay. So mainly it is classified based on the origin, dosage, combination, and paga. Okay. So origin, as you all are aware it is like Stavara and Jangama. Okay. And based on the dosage, it is Hrasiyasi Matra, Madhyama Matra, and Uttama Matra. Okay. And coming to the combination, so since four different Sneha Dravyas we discussed in the first slide, that is Grita, Vasa, Majja, and Taila. So it can be given even in combination. So among them, if any two snehas are combined, it is called as Yamaka. And if any three snehas are combined, it is and administered, it is called as Trivrit. And when all the four snehas are administered together, it can be called as Mahan. Okay. And based on Paga, So that is Mridupaga, Madhyamapaga, and Kharapaga, which will be used for different purposes like internal administration or administering basti or doing abhyanga. So that is decided based on the paga. Next slide. So another important classification or another speciality, that is Grida, it is classified based on Kala. Okay. So based on how much duration it has been kept or it has been procured and kept. So based on that, there are different classifications actually. So mainly it can be Navagrita, Puranagrita, Jirnagrita, Mahagrita, Kumbhagrita, and Kala Parivartita Grita. So among these, in our clinical practice, we will be mainly focusing on Navagrita, Puranagrita as well as your Kumbhagrita. Okay. So here, just a glimpses of where and in which conditions you can use. Okay. Navagrita. So as the name suggests, it is the freshly procured one, or it is a grita which can be utilized less than 1 year old. Okay. So it will be having Snigdha Guna, Madhurasa, Guru Guna, and Kadu Vipaka. But our point of interest specifically is the therapeutic usages. Okay. So where it can be used. So here it can be, it is told Navagrida, it is always Grida, as especially in Indian culture, we promote its usage even in day to day food habits. Okay. So in functions and all, like especially in marriages and all, we usually add Grida to the ahara. Okay. So along other than that, what else? So the main point, Navagrita, it can be used as a rasayana. That is Nitya Sevaniya Dravya also, Grida, it is mentioned. Among them, Navagrita will be specifically useful. Okay. So this is regarding the Navagrita. Next is about the Purana Grita. So regarding the duration or Kala, there are multiple references available. So usually Purana Grita, it can be around 15 years old Gridas can be considered as Purana Grida. Okay. So there will be slight changes in the qualities. Okay. So Navagrida, it was Nigda, Madhurarasa, Guru Gunayukta. But here, Purana Grida, as the age or as the duration progresses, what happens? There will be some changes in the qualities. Okay. So see, Purana Grida, it will be having Legu Guna. Okay. And it will be having Kafahara property. Okay. So Ruksha Tikshna Guna, along with that Kapahara property. So in the first slide, while discussing the properties or gunas, Acharya Charaka has told that it is Kapha Medo Vivardhanam. Okay. So, but if it is Purana Grida, it will be having Kapahara property. And now the main point of interest, that is therapeutic uses. So Purana Grida, it can be used mainly in two conditions. Okay. So that is, one is regarding the proper utilization in case of different types of skin diseases. Okay, especially Egadasha Shudra Kushtas. So there, Purana Grida, if we choose according to the patient and utilize it properly, it can give you wonderful results. Okay, so that is the main domain is your treatment of skin diseases. Another thing is neurological disorders. Okay, especially in case of epilepsy. So regarding Unmada and Abasmara, there are different Grida Prayogas mentioned in Samhitas, as you all are aware. But in case of epilepsy, this Purana Grida, you can utilize it as Nitya Sneha for Brahmana purpose. Okay. So even it is having Medhya Guna, so it will be helping the individual to further delay or reduce the number of attacks he is getting. Okay. Along with proper other medications. Now coming to the third one, that is Jirna Grida. Okay, so Jirna Grida, it can be considered as whichever the Grida which is procured and kept for more than 10 years. Okay, so there again, where it can be used. This Jirna Grita, it is very much in practice in especially in Bala. Okay, in Kaumara Bhritya, cases related to Bala or pediatric cases, especially Graha Rogas, which are again unique concept explained only in our science by our acharyas. So it can be utilized. Okay, and even again, so this irrespective of the duration or irrespective of the type, Gridas always it can be used in, you can blindly use it in case of your neurological disorders. Okay, be it psychiatric disorders or be it neurodegenerative disorders or be it age-related neurological disorders. So here, Jeerna Grida, it can be used especially in Graha Rogas along with Unmada, Abasmada, etc. Okay. So then is Mahagrida. So Mahagrida, as you all know, it is the Grida which is 100 years old. Okay, which has been procured and kept for 100 years. So it will be having much more uh, greater properties or much more useful properties. Okay, so there will be, it is as it is told, like it will be tikta rasa pradhana. Okay, and where and all it can be used here, along with your neurological disorders. Another particular usage, it is specifically mentioned, it can be utilized in rektaja rogas or rogas pertaining to your rekta dhatu. Okay, or diseases where rekta dushti is involved, just like your Vadarakta or your skin related diseases. Again, in some of the kushtas where Rakta dosha is involved, and even in case of Visarpas, you can utilize Mahagrita. Okay. Next is Kumbhagrita. That is, again, it is like stored for more than 100 years, and specifically in some others say that it got that particular name since it is kept in or stored in a kumbha. Okay, so again it is having very lekhu guna. Along with that, it is Tivra Ruksha Guna Yukta. Okay. So where it can be used? Again, it can be used in chronic skin diseases. So chronic skin diseases, how you can be used? So in my practice, what I'm seeing, so in case of chronic skin disorders and all, the Grita or Snehapana more than Shodhananga, it will be helping you if you are utilizing it as Shamana Sneha. Okay. So since Acharya Susruta has even mentioned, so Kushta is a disease where Stoga Dosha Nirharana is mentioned, right? So little by little, you are supposed to remove the vitiated doshas. So in that context, you are supposed to give Shodhana, or your treatment is supposed to be based on Shodhana. But after Shodhana, if you are advising any of these gridas, be it Purana Grida or be it Mahagrida, or for that case, be it Kumbha Grida. So what it does, so after Shodhana again, so Agni, for Agni Deepti also, Grida, it will be Deepana. Okay, it is having Deepana property. Along with that, what it does, since Kumbha Grida, it is having Ruksha Guna, it will be trying to, if some lesions with discharge is there, it will be helping you to stop the discharge. And also in longer run, in the form of Shamananga Sneha, if you are providing it, it will be helpful even to stop the relapse. Okay. Then last one is Kala Parivartita Grida. Though it is very like, it is not that much properly used or popularly used. We usually use Navagrita, Puranagrita, and Kumbhagrita, but just for the knowledge purpose, it is. So it is like up to 10,000 years, you whichever Gridas are kept. So it will be again much more Tikshna. Okay, and it can be used in diseases which are Asadhya Vyadis. Okay, so there are whichever diseases are Asadhya, in such diseases it can be used. Such references are available in our Samhitas. Okay, next slide. So this was a brief classification regarding your Grita based on the Kala. Now coming to the Grita in terms of modern perspective, whatever fact, so it is a very controversial subject. So modern medicine doesn't allow or doesn't promote consumption of fat due to so many reasons. Okay, whereas our treatments, it is like Grita or Sneha Dravyas, it is considered to be Amrita. Okay, so why? So what is the controversy and what are the science or scientific evidences available as of now? We'll see. So for that purpose, this is the chemical combination of your normal Grida. So you should be remembering, it is not regarding any of the medicated Grida, like whichever medicated Gridas we use, like Kalyanaga, all those things. This chemical combination is purely based on the chemical combination of your plain Grida. Okay. So what and all will be there. Okay. So there are so many molecules or so many derivatives which are present along with its quantity. So few of these whatever ingredients or whatever derivatives are there which are of significance for us. Okay, we will be only discussing about that. So first is about triglycerides. So it is like in plain grida, 97, almost approximately 97 percentage of triglycerides will be there, and diglycerides, monoglycerides, like even though it is very less but in significant amount. But coming down to other ingredients, so you can see the vitamins. Okay, vitamin A, vitamin D, vitamin E, and vitamin K. So all these vitamin sources, it can be grita can be, or your normal ghee can be used as a source for this. So what is the significance, I'll let you know. Okay, so other than that, so many acids, okay, palmitic acid, stearic acid, oleic acid, all those acids are also available in significant quantities in if you consider plain grita. So mainly you should be remembering regarding triglycerides, diglycerides, okay, phospholipids, and your vitamins A, D, E, K. So why you should be remembering about this while discussing the further cases, we will be seeing. Okay, so these are all the chemical composition of fat or your normal grita. Okay, next slide. So this is the topic of interest or the hot burning discussion ab- against or against the time, or you can be said like a war of words between different parties. Okay, so since you know, in case of our science, classical textbooks of Ayurveda has advised numerous benefits. Okay, just we saw the properties, what and all it can do, like Krita, right? So it has explained about numerous benefits of your Krita, and it is told one among the Nitya Sevaniya Dravyas. Okay, you are supposed to take it on a regular basis. It has been told in almost all the Samhitas by almost all the Acharyas, be it Brihatrayas or Laguthrayas. But coming to the modern or your what allopathic point of view, so they have developed so many dietary guidelines, even though nowadays it is constantly changing. Okay, constantly the opinions are changing, but what it was the base or basic idea of the modern dietary guidelines, it stated or it recommended what it recommended: avoiding foods rich in saturated fat. So again, you know, there is a classification like saturated as well as non-saturated or unsaturated fat. So they are recommending the in dietary guidelines. They were recommending like non saturated fats are okay, but saturated fats like ghee or grita, it is better to be avoiding. That was the point of their dietary guidelines. But actually nowadays it is getting revised. Okay, so nowadays you will get so many doctors speaking very highly of grita or highly of your thaila, telling that it can help in numerous conditions. It can help in managing cardiovascular diseases compared to the older times when they were trying to establish that this consumption of grita had been a reason for increased cardiovascular diseases. Okay, so now we will be seeing with scientific evidence whether grita can be consumed in real or as the modern medical science recommends, it should be better to be avoided. So we'll see with some of the available clinical evidences. Okay, so always traditional medicine and modern medicine had been in different opinions, especially in so many concepts. But one among the burning issue is this one. Okay, next slide. So there have been so many studies and so many articles you will get, but clinical studies, it has been now it is popularly studies are going on, but as of now whatever studies are published, so there are some very few studies which can be reliable. Okay, so which states the role of grita or your fat in the lipid profile of a healthy individual as well as a diseased individual. So here is a study published in one of the reputed journals. It is like lipid profile in healthy human volunteers before and after consuming grita, okay, or ghee. So this was done in a North Indian population or North Indian people, okay, and they studied about the people who are consuming grita greater than 1.25 kg per month, okay, and and also mustard oil, like compared to grita, reduced quantity of mustard oil that is less than 0.5 liters per month. Okay, and they were what they were using, they were trying to find out what will be the changes which will be happening in the lipid profile after the consumption of this. Okay, so whether it can be beneficial or it can be hazardous. To find out that, they have done this study. So there had been separate studies which had indicated that this will be good cholesterols, or your HDL will be increased by the consumption of grita or ghee, and there can be reduction in the bad cholesterol or your LDL in case of proper consumption of ghee. Okay, so what it does, it will be, so another study conducted. So this was one study which indicated that regular consumption of higher quantities of grita, which is like greater than 1.5 kg per month, so it had shown that it will be increasing only your HDL, which is good for your heart health, and it had even reduced the bad cholesterol levels. Okay, so another study had happened in rural population in India, which, so that finding is very much significant here. So you can see in the slide, another study conducted on a rural population in India found out that men who consume greater quantities of ghee had a notably lower incidence of CHD. Okay, notably lower incidence of coronary heart disease. Why? So, as in another study, it was found out, right? So, HDL was improved with the usage of Krita. So, HDL will be supporting your heart health. Okay, so even there are another studies which have done that it will be regular consumption of Grita or ghee has reduced the incidences of your coronary heart disease. Okay, next slide, man. So details regarding that particular study. Okay, so this was a study which was done according to the modern scientific principles. Okay, and it was even registered in the CTRI. You can see the register number also. Okay, so this study was a prospective interventional study. Okay, where it was done? It was done by the Department of Physiology, Sri Venkateswara Institute of Medical Sciences, and Sri Padmavati Medical College, Tirupati. Okay, so what they did? So they had recruited the subjects, okay, based on a particular questionnaire. Okay, after assessing particular questionnaire to rule out the any previous health issues. Okay, so aged between 18 to 60 people, 18 to 60 years of age. So healthy subjects were selected. Okay, and they were having particular inclusion as well as exclusion criteria regarding any other illness, any other medications, etc., and who are willing to have Go-Grita specifically. Okay, cow's ghee specifically, Go-Grita, who are willing to take it orally, they were recruited. Okay, next slide, man. So they, whenever they were, once they were recruited, okay, what they did, they had given 1,470 grams. Okay, 1,470 grams of Go-Grita, cow ghee, which was prepared obviously by the investigator. Okay, and it was given for 6 weeks. What was the dosage? Daily 35 grams. Okay, so daily 35 grams were given for 6 weeks. Cow's ghee, and it was confirmed by phone call. Okay, whether they had taken it or not, and they were for proof or for the purpose that they have properly taken it. So they even advised them to bring the bottles at the end. So regarding this, during this time, they even the subjects were advised to maintain a vegetarian diet, okay, and constant levels of physical activity, etc. So what it does after a month, what was the finding? Okay, so that is being highlighted in the slide. Okay, data shows the effect of inclusion of desi cow ghee in diet for 6 weeks for predisposition of atherosclerosis. Okay, so see, 6 weeks when Gogrida was included in the diet, what it does? It doesn't produce any dyslipidemia. That is, it had not changed or had not made any changes in the lipid profile. Okay, there was no increase in the total cholesterol, triglyceride, LDL, VLDL, etc., or decrease. Okay, rather, what it does, it improves the dyslipidemia. So those people who are already dyslipidemic, if they when they were consuming 35 grams of the grita, what it does, it reduce the total cholesterol as well as LDL. So especially LDL, it is your main enemy to the heart health. Okay, so yeah, what it does, so whenever those who are whose lipid profile was normal, it didn't had any impact. Okay, it neither increased or neither decreased the lipid profile. So, but in case of already dyslipidemia patients, what it does, it decreased TC and your LDL. So, in this way, so from these studies, what can be concluded? So, next slide. So, it is that whatever grita, this is we are discussing only about the go grita or plain grita. Okay, so what it does, it will not be causing dyslipidemia, rather it will be improving your dyslipidemia. Okay, by and as well as it will be improving your heart health. Okay, so here so there is, as you all are aware, there are murchita gritas and amurchita gritas. Okay, so murchita grita, that we will be specifically processing it with different medications or different herbs to attain particular property. Whereas amurchita grida, it is again raw ghee or raw grida without any uh, addition of any other herbs. Okay, so this is just some differences regarding your murchida and amurchida gridas. Okay, so as I told, murchida grida, it is processed with different herbs to enhance its properties, so as it can be utilized for medicinal purposes. Okay, and amurchita grida, it is directly obtained raw grida from cow, etc. Okay, so there are how Murchana Murchana is done. So there are Murchana Samskara where different herbs like your Haridra, Triphala, etc. will be added or etc. will be subjected to undergo Murchana Samskara, which will be enhancing the quality of your normal Grida, that is Murchida Grida. Amurchida Grida, it will be directly taken without any addition of the any other herbs. Okay, so rasa regarding taste. So Murchida Grida, since it is processed, it will be more palatable. Okay, compared to Amurchida Grida. So whereas Amurchida Grida, it will be having Tikta Kashaya rasa and it may be unpleasant to have. Okay. So gunas, Murchida Grida, it will be obviously Grida, as I told in the starting slides. Grida is having a very beautiful quality called as Samskarasya Anuvartana. Okay, so that is whatever you mix with the Grida, it will absorb the qualities of all those substances without losing the basic quality of its own. Okay, so here Murchida Grida, what happens, since it will be whichever drugs you are or whichever herbs you are utilizing for Murchana Samskara, it will be accepting all those qualities. Okay, that is Legu, Snigdha, Shuddha gunas will be there. Whereas in Amurchida Grida, it will be Guru and Snigdha. So since Grida, it will be Snigdha Guna. Along with that, since the Murchana is done, it will be Legu in case of Murchida Grida. And in case of Amurchida Grida, it will be again Guru Guna. Okay. So next slide. Man. Next slide, please. Man. So next, considering other qualities, okay. So your Murchida Girda will be can have either Ushnavirya or Shiravirya depending upon the drugs which you utilize for Murchana, okay. Whereas Amurchida Girda will be usually Shiravirya. So you should be thinking here, Shiravirya drugs or Shiravirya property is there, it can lead to Agninasha. Okay, so that is why Amurchita Grida is less beneficial medicinally compared to Murchita Grida. That is why Murchana Samskara is explained specifically in case of our medicine preparation. Okay, next is Vibhaga. So you Murchita Grida, it will be of Madhura Vibhaga and it will be having Dhatu Poshana, Brahmana as well as Rasayana qualities. Whereas your Amurchita Grida can be again, it will be Madhura Vibhaga or it can be Madhura Vibhaga Yukta, but it will not be doing that much Dhatu Poshana as well as that it will not be having that much Rasayana effect. Why? Because since it is Amurchida, it will be there can be presence of Ama. Okay. Next is regarding the Prabhava. So as I told, no, Murchida Girda, it can be having Deepana Pachana property or Agnivardhaka property. It can be Rasayana, it can be Medya, and it can be having particular Vyadi Pratyanika gunas. Okay. Whereas Amurchida Guruta, it is less specifically used for medicinal purposes. And doshas. Okay. So doshas, in case of Murchida Girda, it will be depending purely, dosha harana will be purely depending on the drugs or qualities of the drugs which are used for Murchana. Okay, whereas in Amurchita Grida, since Ama is present, obviously it will be increasing your Kafadadu. Okay, and it can even lead to Agnimaldi. Next, coming to the Agni. Okay, so this Murchida Grita, it will be Deepana Pachana and it will be doing the Agni Vardhana. Whereas Amurchida Grita may cause Agni Mandya. Okay, since the presence of Ama. So regarding the safety and acceptability, so since it is Murchana is done, since along with Murchana even Shodhana will be happening. So that is why Murchita Grita is usually acceptable and safe to be used, especially in case of internal administration. Okay, whereas Amurchita Grita, it is usually less acceptable because it is not processed and there can be chances of any irritations to the GI tract or even in case of skin, etc. Okay, so these are the what differences between your Murchita and Amurchita, and by these things you will be now having an idea why Murchana should be done. Okay, so now again this Murchita and Amurchita Gritas were also subjected to study. Okay, since whatever properties are there, it should be accepted. It will be accepted or it can be accepted only with scientific evidence or scientific studies to other people. Okay, like to more, let it be modern medicine people or other field of people, they will not be accepting our references. Okay, it should be scientifically proven. So these even this Murchida and Amurchida Girdas were also studied comparatively. Okay, next slide. So regarding its shelf life and all, okay, whenever the shelf life is increased or it is stored for more duration, the properties also increases that we or improves that we saw in that classification regarding Purana Grida, Navagrida, etc. Like that. Okay, and smell and color also Murchida Grida will be palatable in case of appearance, in case of taste, etc. Okay, and it can be used in different conditions. So examples are also given. Okay, and you should be knowing Amurchita Grida is considered unfit for medicinal purposes. Okay. And there are different references, even in Brihatrayis as well as in your Lekutrayis, it is mentioned. Okay. And even in recent texts like Gada Nigraha, etc., there are different usages of Gritas or Snehadrivyas are mentioned. Okay. Next slide, ma'am. So this is again, this was what I was discussing regarding the effect of Murchida and Amurchida Grida on lipid profile. Earlier we saw plain Grida, okay, normal Go Grida, how it affected. So the study result were like it was not disturbing your lipid profile, rather it was improving your dyslipidemia, okay, and it was improving even the heart health. That was the study found out in case of plain Go Grida, okay. Now coming to the effect of Murchida as well as Amurchida Grida on lipid profile. So you now know what is Murchida Grida and what is Amurchida Grida. Okay, this was a study done by the title Hypolipidemic Activity of Panchatikta Grida. Okay, prepared by Murchida and Amurchida Grida. So Panchatikta Grida, which was prepared which using Murchida Grida as well as which was prepared without any usage of Murchida Grida, how it helped in or how it helped in the lipid profile. Okay, so directly going to the study summary or findings. Okay, so the Panchavikta Grida, which was prepared with Amurchita Grida. Okay, so what it does, it increases your so normal control, 52 plus or minus 4 is the total cholesterol, 26 plus or minus 3 is the HDL, 17 plus or minus 2, 1.2 is the LDL, and even triglycerides, it is 89.5. This was the normal level, okay, normal control level. So, Panchatikta Grida prepared by Amurchita Grida, that is without any processing, raw Grida, if it was used for the preparation of Panchatikta Grida, and if that particular Panchatikta Grida was consumed, what it does? So, it will increase your total cholesterol to 61, it will increase your HDL to 32, it will reduce your LDL, and it will increase your triglycerides. Okay, so whenever Amurchita Grida was used, what it does, except your LDL, all other parameters were increased. That too significant increase. See, 89.5 of triglycerides went to almost double quantity, right? So that was a significant increase in all the lipid profile parameters. Okay, that is total cholesterol, HDL, LDL, and triglycerides. But when that same Panchadikta Grida, which was prepared with Murchida Grida, what it does, see, it will be reducing your total cholesterol. Okay, so normal control was 52, it has come down to 32. Okay, HDL was 26, it had increased to 34.6. That is, HDL is good for us, right? Good for the heart health. And LDL, it was 17, it has significantly reduced, reduced to 7.5, which is again good for your heart health, right? And triglycerides, it has been slightly increased. Okay, but since HDL was increased significantly, your LDL was lowered significantly, and total cholesterol again was lowered, so that triglycerides can be of less significance here. Okay, but to conclude, what I want to say, this study has proved that amurchita grida will create disturbances or dyslipidemia or aggravate the dyslipidemia already present, whereas Murchita Grida usage, it will be improving the lipid profile. It will be significantly improving the lipid profile along with the improvement in the cardiovascular health. Okay. So this was again another study. Okay. And several studies now, inspired by all these, several studies are going on in different countries. Okay. Not only in India, and that too, not only by Ayurvedic people, even other medical system people are also interested now in finding out the properties of grida and how it can be utilized. Okay, so many studies are going on, and you will get multiple number of studies in the internet, even in reputed journals where it has been conducted. So most significant ones I have taken here for the just for the reference purpose. Okay, so next slide, ma'am. So now grida, so what and all we discussed regarding the qualities of Grida, why it is significant, what and all are the types, what and all diseases it can be used. All these things we discussed, along with the scientific evidence regarding whether it will cause cholesterol or whether usage of Grida can be harmful for the heart. All those things we discussed with the scientific evidence itself, right? So now we will be seeing. So now you know that usage of Grida can be used regularly. Okay, there are evidences that it will be improving your heart health, right? So even in our acharyas have told it long back that Grida can be a Nitya Sevaniya Dravya, right? Now we will be, since I told you, Grida can be utilized from infants to the elder people. Now we will be seeing how it can be utilized in the healthy people for the promotion of health, and later we will be seeing about the usage of it in diseases. Okay, so first coming to the usage of grida in children. Children in the sense just from the newborn, okay, so neonates to adolescent. That is just newborn baby to 16 years, how and all grida can be utilized. Okay, so there are so many references regarding the usage of grida in your various samhitas, especially majority of that can be found in Kashyapa Samhita Kilastana. Okay, so what and all it can be done. So especially there is a concept called as Grida Abhyanga in Bala. Okay, that is just newborn baby can be advised at Abhyanga with Grida. Acharya Kashyapa has clearly mentioned what it does. It is Twachya and Varnya. So if Grida Abhyanga is done, it will be helping to provide good luster. Okay, good luster to the children, along with that good skin texture, and okay, and it will be helping in improving the skin of the children. So that is from neonates, that is after 7 days of the delivery to up to 16 years, this grida abhyanga can be done. Okay, especially, but it is specifically, it will be better if you are doing it in the early baby phase. Okay, or within 1 year. Okay, so there are different references regarding that. And why Abhyanga is done, it will be improving the bella. Okay, it will be giving texture to the skin. It will be giving color to the skin. Okay, and it will be Gridam Pitta Anilaharam, as I told. So it will be reducing both your Pitta dosha as well as Vada dosha, and it will be helping in even improving the digestion. Okay, so there are different Gridas explained. Okay, especially Samvardhana Grida, which is mentioned by Kashyapa, then Belagrita, okay, Ashwagandha. So all these things, what it does, it will be helping in the neurological development. Okay, so nowadays, there are so many cases of early neurological disorders, okay, or early psychological disorders for that case, like ADHD, etc. So if in the earlier phases you are utilizing grida, it can be given even internally, or even for the external purposes. What it does, it will be helping in the proper neurological development, especially the usage of Belagrida, Samvardhana Grida, or even Ashwagandha Grida for that case. Okay, so how it can even improve the immunity of the child also. There has been studies that has also stated the same. Okay, but again, regarding this also there is so many difference of opinion. So there are so many doctors who will be advising not to pour any grita or oil to the newborn baby, instead to use different types of powders. Okay, different types of powders, etc., to the child. So, but in Indian, especially in rural India, so if our elder grandmas, grandpapas, okay, grandfathers, etc., they were supporting the usage of this. So they were using Grida for Abhyanga, Taila for Abhyanga. They were even giving Grida internally, which had helped for the proper development of the child, okay, physical as well as the mental development. So it can be utilized. There are references for that also. Okay, so how it is, so for children, how it can be done. So around 15 to 20 minutes, you can do the gentle massage using Grita, or even using for Thaila also for that purpose. And it should be followed by the lukewarm water bath. Okay, so which will be helping in the improvement of skin as well as the other higher mental faculties. Okay, so next slide. So here, this is just like from Bala to Vridha. I was discussing the same thing from newborn to the age-old people. It can be utilized Vridha. So here, it is just a depiction what it does. Okay, age-related diseases you see. So newborn, I told for newborn, for improving the mental faculty as well as improving the skin texture, color, etc., it can be utilized. But in the adult age or in the teenage, due to irregular food habits, there will be issues related to your GI tract, okay, acidity, GERD, etc. Right? And even IBS nowadays, it is very common. Okay, and when it goes to middle-aged people, so obviously your respiratory system diseases as well as the cardiovascular system diseases are more prevalent nowadays. Okay, and then when it goes to the middle age or above middle age, it will be always related to your bone or asti related disorders. It can be degenerative diseases like OA, etc., or it can be other diseases related to the spine, okay, like lumbar spondylosis, ankylosing spondylosis, etc. So in all these cases, you can utilize grida if you understand the principle mentioned, if you understand the patient, or if you understand the people who are in need, and if you understand his or her koshta, agni, etc., and if you are properly prescribing, it can give you wonders, okay, literally. So there is a reference in the first chapter itself, Charaka Sutrasthana, Gridam Agni Medo Karodi. So the same thing we discussed already. It will be improving your Agni as well as the Meda. Okay. So here, if you see in that image, particular image, whatever six images are given, so this Agni and Medo Vriddhi will almost mitigate every issue faced by those people, right? So in the infant, it will be Medo Vriddhi will be there, right? It will help in Medo Vriddhi, which will be helping in proper development. And in all other people, so let it be GI tract diseases, let it be cardiovascular diseases, let it be ASTI related diseases, let it be respiratory system related diseases. First line is your acne should be corrected. Okay, Sarva Rogo Abhimandagno. So your treatment also should be Agni, correction of Agni, which Grida will be helping you. And in with that simple practice, even you can sometimes cure very difficult or chronic health issues also. Okay, so there are examples that we will discuss. Now again, coming to the Sutrasthana 5th chapter of Charaka Samhita, he explains about the Nitya Sevani Dravyas. So I was telling from the beginning itself, right, that Grida can be used daily, Grida can be used daily. So this is the reference. So which and all Dravyas can be used regularly. Shashtikashali, Mudga, Saindavalavana, Amlaki, Yama, Antarikshapaya, Sarpi, or Grida, Jangala Mamsarasa, Madhu, It can be obviously it can these things can be utilized regularly. If it is utilized regularly, it will help you or it will give you Rasayana effect, right? Next slide. So next is again. So we discussed about the children and even other age ways how it can be utilized. Another thing is that Grida it plays a major role in case of Sudhika Paricharya. Okay, so there are Sudhika Paricharya or principles of Sutika Paricharya, which are explained in different acharyas during different durations. Okay, Charaka's duration was different, Kashyap's duration was different, even Yogaratnagara's duration was different. But Grita plays a significant part, be it in case of internal administration as through Ahara or be it in the form of Basti, etc. Basti, etc. But this was what Grita plays a very significant role in case of Sudhika Paricharya. So we will be seeing one by one just a glimpse of how it can be utilized, right? Acharya Charaka, he always, since it is like, since Acharya Charaka is more specific regarding the Chikitsa, he always care for Agni, okay? So irrespective of the condition, irrespective of the age, he always care for the Agni, even in the Samprapti, right? So Charaga emphasizes the usage of Krita for Agni Vardhana or for improving the digestion as a Samsarjana Krama. Okay. So how he is telling to use Nitya Sneha or use Shamana Sneha in the form of Shamana Sneha followed by light diet. Okay. That is from Charaga's point. Okay. So in which month it is to be used, that is again different context. Okay. Now coming to the Susrata. Again, Susrata is also, I feel like he is also more clinically oriented, right? Not only in case of surgeries, even in the general diseases, he is very much, his principles are very much unique and very much effective, I feel. So even what he does, he is even explaining the Agni Deepana property, but along with that, you should be careful here and you should be having your special notice here that is not only for Agni Deepana, Susruta even tells the administration of Girda for Brahmana purpose as well as Vadashamana. So Brahmana and Vadashamana, what is its role in a Sutika or what is its role in case of delivery? Okay, so that Brahmana, what it does, so obviously Brahmana will be helping the child or helping the baby growing inside to have proper physical as well as mental development, right? Brahmana, proper Brahmana is that. Vada Shamana. So Vada dosha plays a very important role in case of deciding whether it will be normal delivery or it can be C-section. Vada dosha's role is very important. Okay, Vada dushi, it depends on Vada dushti. So if you are correcting Apana Vata, most of the times it will be normal delivery itself, right? So for that purpose also properly administered, carefully selected, properly administered Grida Prayoga can help in that. Okay. So what he does, he gives Grida for Agni Shodhana, Agni Vritti as well as Brahmana and Vada Shamana property. So how it should be given? It should be given after Shodhana. Okay, how after Shodhana it should be mixed with Manda or Peya. Okay, it should be mixed with Manda or Peya and given, or even it can be given as the first mixed with the first bolus of your food. Now coming to Vagbada again. So Vagbada also mostly uses the Dhatu Poshana property along with Vada Nilomana. Okay. So it is like he says after delivery you are supposed to gradually introduce Grida. How it should be? It should be mixed with the Ahara. Okay. Then Kashyapa. So Kashyapa is like other than this, Kashyapa what he thinks of the Garbhashaya as well as the general recovery of the lady after the delivery for keeping in that mind what keeping in those factors in the mind emphasizes the usage of girda how it should be used within 5 to 7 days after the delivery or postpartum. Okay, so he directly tells it can be given as medicine. Okay, in medicated form, medicated girdas like shadavari girda etc can be given, which will be even improving the lactation. Okay. Then coming to the Yogaratnagara, he is also again Vada concentrated, Vibanda, and appetite. So just after delivery from third to fifth day, it can give. How it can be? It can be directly internally given. Okay. Next slide, ma'am. So, in this, whatever the Sudhika Paricharya Grita Prayoga or Grita usage, you should be remembering it will be mainly focusing on correcting the Agni, correcting the Vada Dosha Gedi, as well as providing Brahmana, which will be helping in proper development and nourishment of the newborn. It will be helping in restoring the balance as well as the health of the female who had just delivered. Okay, and even helps in the avoiding or improving conditions like constipation, etc. Okay. So in this slide, there are different dhatu specific gridas are also mentioned. Okay. So these references you will not get directly at a place considering for each dhatu, each which is a grida, but these are scattered references which I have collected and kept together in a box, so it will be easy for you. Okay. So each particular dhatu related vikaras, you can use this, or even each particular dhatu portion of purpose, you can use this. Okay. So ingredients, majority of the ingredients, what and all will be there. So we'll be just focusing on the dhatu and specific gridas. Okay. So first is rasa dhatu. So in rasa dhatu related diseases, what and all will be there if you think. In all those diseases, you can utilize your Sukumara Grida. Okay. It will be helping in the new proper nutrition, circulation, as well as the immunity. Okay. So Sukumara Grida, that is, it includes Trivada, Draksha, etc. Okay. Then coming to the Rekta Dhatu, you can utilize Mahatiktaka Grida. This Mahatiktaka Grida, it is a very unique formulation which works just like in modern medicine, just like how they have broad spectrum medications. Just like this, our Mahatiktaka Grida is actually a broad spectrum Sneha, you can tell for us. How it so in Rektadadu, majority of the Kushta, Rektadadu will be involved. Okay. And even diseases like Vadarekta, Visarpa, etc. So Mahatiktaka Grida based treatment protocols, if you are following, it can have very beautiful results. Okay. Even in case of Vadarekta, why I told, in case of Vadarekta, there is a mention of Shiravasti, right? So in that, you can use Mahatikta Grida. So only Tikta Dravyas are there, which are predominantly your Pittahara. Okay. So that is for your Rekta Dhatu. It will be even improving the blood circulation as well. Okay. Next, coming to the Mamsa Dhatu. So for Mamsa Dhatu, Panchagavya Grida. So usually Panchagavya Gridas can help in the improvement of the physique, okay, or improvement of the your tissues. Next is about the Medo Dhatu. So Medo Dhatu, even for Medaharana purpose, so many Gridas you can use, especially those with Ruksha and Legana properties. But here, Amlaka Grida, it can be used, so as it will be helping in the portion of your Medo Dhatu. Okay. Next, coming to the Astidadu. So Astidadu, even for improving the Astidadu, Trina Panchamula or Trayamana Panchamula Grudas can be used. Okay, so which will be having even Astisrinkala, Desamula, etc. Okay. Majja. So for Majja Dadu, Brahmi Grida. Okay, so it will be having major Rasayana drugs will be having mainly predominantly, which will be helping in the bone marrow formation as well as your nervous system. Okay. Next, coming to the Shukra or Artava. So you will be always knowing this. Whenever it is related to gynec or genito-urinary system, the drug of or grida of choice is always your Phalagrida, right? So, same case related to Shukra and Artava things, you can use Phalagrida, okay, which is having more of Vajigarana Dravyas, okay, and Brahmana Dravyas, okay. So, these are all the certain gritas which can be maximally used in case of these dhatu related diseases or even for improving these dhadus. Okay. Now we will come to the clinical studies or the usage of grita in diseases. Okay. So there are few cases which had shown very significant result with the usage of grita along with other medications. Okay. So we'll see one by one. Now first one is about Kittiba Kushta. It is, as you know, it is one among the Shudra Kushtas mentioned by our Acharyas, right? So this was a patient who was suffering from these such skin lesions for a very long time. Okay, he had tried so many medications, so many treatments he had tried, still it was not reducing, and somebody had told that you try once Ayurveda. And he had come to us with the situation with the lesions spreaded all over the body, just like in the first pic. Okay. So what we did, we had assessed his Agni and we had started with Deepana Pachana followed by Snehapana using Tiktaka. Okay, so and it was followed by once the Sammik Lakshana was attained, uh, Eshtimadu Taila was used for the Sarvanga Abhyanga Sveda and followed by Trivrit Lehe was given for Virechana. So once Virechana was done and Samsarjana Krama was followed, we had given him few medicines. Along with those medicines, we had given him Tiktaka Grida as a Shamana Sneha. Daily you should be taking 5 ml of Tiktaka Grida in empty stomach in the morning. We had advised him and we had sent him. Okay. So you can see the changes just during the Virechana itself, how it was, you can see the changes, right? So in the post Virechana, the lesion started to improve. Okay. Then he had taken the medicines and he had went. So after 1 month, he had come. So we had made some changes. Along with that, the only common thing was the again continuation in the usage of Grita. Okay. So after 6 months, you can see around 60% improvement was there. Okay. Then after 8 months also picture you can see there, followed by the picture after 1 year. Last picture is the image after 1 year. Okay, so almost 99% of the lesion was completely disappeared. But regarding the skin diseases, you should be always remembering there will be a recurrent phase as well as there will be a dormant phase. Okay, so there will be that particular lesions will be subsided for a particular amount of time, and if some triggers are there it can even come back. So that should be the most important part, is educating the patient. Okay, so if these lesions are going away, you are not supposed to tell them that it will not come back again. So there can it be remissions. So whenever remissions are there, you are supposed to come for the consultation and we are supposed to assess the dosha dushyadi during that particular time, and we are supposed to use the medicines accordingly. Okay, so this was purely, so after 1 year we had not given him any medications was stopped, and whenever in between he used to come with small little lesions, we used to tell them to take only Shamana Sneha. Okay, so this was one beautiful case which had got within 1 year, even though in this case the patient as well as the doctor, I must say, the patient as well as the doctor was very patient enough to assess and to wait for the results. Okay, and they were following A to Z what we were advising them. Okay, so this was one case. Next, coming to the second case. Next slide. So second case was of a Visarpa. It is like it is more somewhat more severe because the patient had come to us with boils. Along with that, severe burning sensation was there. Okay, so he had even taking medications. He was previously diagnosed, and he wanted something to reduce the burning sensation. So keeping in the mind regarding the role of Pitta dosha. Okay, so we had given him initially we had given him external therapies also. Okay, so followed by when his condition was little bit improved, we had planned for Virechana. Okay, Virechana was done. After Virechana, so Virechana was done predominantly keeping in mind the Pitta dosha. Tiktaka was predominantly used, and even after Virejana, we had given him Panchatikta Grita for Shamana Sneha for some duration. And you can see after Virejana what happened to the lesions. Okay, so always keep in mind, even if you are not able to assess exactly the amount of dosha dushas involved, you can even opt for Shodhana in majority of the cases, since Stoga dosha nirharana is mentioned and it is the key in the management of your skin diseases. Okay, let it be Kushta or even in case of Visarpa. So this was again, we had to control his Pitta dosha, we had advised him on and off Shamana Sneha. Okay, and he had recovered very well. This was another case. Okay, so why these skin cases we choose majority? So why I am discussing about only skin cases here majority is that I can show you the effects, okay, pictorially at least. So in case of diseases like grahani etc., even though it is having very good effect, I cannot show you any evidence as such, right? Only subjective parameters will be there. But in case of skin cases, what happens, I can show you the changes in the lesions. Okay, so next slide, ma'am. Next slide, ma'am. Yeah. So this is another in case of Shudra Kushtas. So this Vaibhadika Kushta, it is like the only medicine you can say, or even the only required medication in case of Vaibhadika Kushta is your proper selection of Grita and proper administration. Okay, there can be different methodologies. So even Rekta Mokshana you will be doing, or even internally so much medications you can give. But in my practice, what I feel or what I see is that most of the Vaibhadika cases, just with Shamana Sneha only, I was getting very good results. Okay, so this was a case, it was chronic, even you can see in the first image. Okay, so that was like even in the feet also she was having such severe chronic lesions. Okay, so when she had come, so it was like the main complaint was itching, predominantly itching she was having. Okay, no burning sensation, itching, and such lesions were there, and even oozing was there. Okay, starting. So we had given her again classical Virechana. This time Gugulu Tikta Krita was used. Okay, since the discharge was there, Gugulu Tiktaka Krita was used since it is having Shoshana property as well as Tiktaka Krita will be reducing the Pitta. So Gugulu Tiktaka Krita was used and classical Virechana was given. So after Virechana, only this Pancha Tiktaka Krita was given as Shamana Sneha. Only that was the internal medication. Okay, so only that Shamana Sneha she was taking for 1 month, nearly 1 month. Along with that, for external application, we had given. So only with Panchadikta Krita Shamana Sneha, that much result you can see in the right side. So it was almost completely cured. So Vaibhadika, whenever you get Vaibhadika cases, you can blindly you can use Grida. So that too, if you are not confident enough to particularly pick a Grida, you can either go with Tiktaka Grida. If discharge is there, you can go with Google Tiktaka Grida, or even Panchatikta Krita you can give. Okay, you can use it. So majority in skin cases, you can either opt Tiktaka or Mahatiktaka Krita, or if secretion or discharge is there, you can use Gugulu Tiktaka Krita. Okay, so this was again another case which was treated solely with the proper utilization of the Grita. Okay, so next slide, man. So next is like in Avabahuga Chikilsa, Ashtanga Hridaya says, Avabahu Hidam Nasyam Snehasya Uttarabhaktigaha. So nowadays, Avabahuga cases very frequently we are getting in clinical practice, especially those associated with diabetes. Okay, so in such cases, especially in those cases with radiating pain from the shoulder to the hands as well as in presence of stiffness. So nasya, it is usually the treatment of choice is nasya, but along with that you can see there snehascha uttarabhaktiga, that is uttarabhaktiga snehapana. It plays a very important role and very effective role actually in managing not only in avabahuga, even in cases of early cases of pakshagada, sorry, in early cases of parkinsonism kambavata, even is Uttarabhaktika Snehapana, I am seeing very nice results. Okay. So here in case of Ababahuga, the line of treatment is Nasya followed by Stanika Abhinga Sweda we usually prescribe. Okay. So after that, internal medications, as you know, Trayodashanga Gugulu you can utilize. Okay. And along with Kashayam, so for Urto Jatrugada Vigaras, Prasaranyadi Kashayam you can specifically utilize. Along with that, if you give Uttarabhaktika Snehapana, what it does, so you should be remembering in, or you should be seeing the, keeping in mind that in case of avabahuga or frozen shoulder associated with your diabetes, so what happens there, the collagen destruction will be there. So Uttarabhaktika Snehapana, what it does, it will be even having Brahmana quality and it will help in the improving your collagen there. Okay, so that is why Uttarabhaktika Snehapana, usually if you give, it can be given using any of the Belya Gridas. Okay, just like Shirabala you can give, or Kalyanaga you can give. So such Gridas, if you give Uttarabhaktika, so for Uttarabhaktika Snehapana, there are different practices available. Okay, like in case of regarding the dosages. So usually either you can administer in increasing dosage. Okay, you will start with 5 ml daily, 5 ml increase you can give. Or if thaila you are supposed to, you are planning to give thaila, you can tell them to have a glass of milk In that, you can 5 to 10 drops or 5 ml you can add, and gradually you can increase it. Okay, so what I practice is, in a glass of milk, to start with 5 ml of grida. Okay, so gradually we will, seeing the agni, we will increase the dosage of the grida gradually. So daily after food they are supposed to have it in the evening. Okay, so this is the practice of Uttara Bhakti. So there are so Uttara Bhakti Snehana which I follow. So there are so many practices, different types of practices, but in all, in general, Uttara Bhakti Snehana helps very nicely in Avabahuga, as well as especially even in Kambavada. Okay, so in several Kambavada cases, I am seeing that if you are advising along with drugs like Brihadvada Chintamani or Eganga Virarasa, if you are providing Uttara Bhakti Snehapana also as a modality, it gives very significant improvement. But the thing is that in case of Parkinsonism, etc., the dosage should be very much higher. Okay, it will not be useful if you are going with 2 ml, 5 ml, etc. It should be predominantly higher. Okay, so that is again concept of Uttara Bhaktika Snehapana also. So next, one more we will discuss. Okay, mainly in case of Grita, in case of Jwara. Okay, so there is a reference again in Charaka. Atha urdhvam kafe mande vada pitta uttare jware paripakveshu dosheshu sarpishapanam yata amrutam. So this sarpi or grida, it is considered as amrita in so many different contexts. Okay, so daily usage it is considered, it is uttamam, it is considered, right? So here in case of jwara, what he says here, okay, ada urdhvam kafe mande. So that is kapha is lesser. Okay, oh, and predominantly vada pittaja jwara. In case of predominantly in case of vada pittaja jwara, after paripakwa avastha, if you give sarpipana. So why vada pittaja specifically? That is gridam pitta anilaharam, right? So specifically in case of pitta vadaja or vada pittaja jwaras, if you give after pakwa avastha or after ama is gone, if you are giving sarpi or gridapana, it acts as amrita. It is just like a nectar. Okay, so what you can interfere or what you can conclude from whatever we discussed from the beginning. So be it in healthy individuals or be it in children or be it in elder or even in case of people suffering from chronic diseases, Grita always acts as Amrita. If in the bracket, you should always keep in mind, if it is properly selected, properly prepared, and properly utilized. So in my practice, I depend a lot on Grita. Okay, so and it has given me very beautiful results. So next we'll discuss about some of the main Gritas which can be used in particular diseases. Okay, next slide, ma'am. So these are the gritas which are classically mentioned. Okay, so in that particular disease. So in case of Unmada, you can have so many different gritas are mentioned, but in specifically you can go with Mahapaishajika grita. Even in Abasmara, Mahakalyana grita you can use. Graha Rogas. So Graha concept of Graha again, it is an unique concept and very much interesting concept if you are understanding it properly, and its treatment is again beautifully mentioned. So in those conditions, especially Acharya Kashyapa has given certain gritas, again Saraswata grita, Brahmi grita, Samvardhana grita, etc. can be utilized. Okay, now the disease of choice or one of the major diseases which you can give successful results with Ayurveda, that is Kushta. So mainly Tiktagagrida, Mahatiktagrida, Panchatiktagrida, Gugulu can be utilized. Along with that, if Nimbadigrida also can be used. So what is the idea? That is, it should be Tiktarasa Pradhana and which should be Pitta Shamaga Dravyas. Okay. So usually we use Tiktaga and Gugulu Tiktaga. Okay. Along with that, Mahatiktaga also we use. Nimbadi, even it will be giving you better results. Then Netra Roga. So in case of Netra Roga for the Kriya Kalpas and all, specifically Jivandhya Digrita can be used. And again, in such disease, in diseases related to your eyes also, Grita Prayoga or usage of Grita, be it in the form of internal administration, be it in the form of Tarpanadi, Kriyas, etc., it will again give you wonderful result. Okay. Then coming to the Vandyatha or infertility, it can be male infertility or it can be female infertility. So mainly Phalagrita, which can be used in both. Okay, male infertility as well as female infertility, and Shatavari Grita, which can be specifically used in female infertility as well as for it is having properties for improving the lactation also. Okay, so that can be utilized. And in case of Vrana, so Vrana, it can be different types of Vrana. It can be diabetic ulcer, it can be venous ulcer, whatever is there. So it can be Jatyadikrita can be used. It can be used even for packaging or it can be used for application. Okay, and even in case of Arshas, Bagandhara, etc. Also, Jatyadikrita Matravasti or Eshtimadukrita Matravasti, Eshtimadu Taila Matravasti can be given, which will be very much helpful in improving the wound. Okay. So this is mainly this was like usage of Grida. It can have very much significant impact on the uh, managing or management of different diseases. Okay, chronic, especially chronic diseases. So I urge all the practitioners to have a proper understanding regarding how to be used, where to be used, and which gridas can be used, and utilize it to the maximum extent so that you can flourish in your practice. So once again, I would like to thank Team Ayuryana who had given me a wonderful platform to share my ideas and hoping to collaborate for more in the future. Thank you so much.
Thank you, Dr. Arun, for wonderful session. The insights shared were impressive, empowering, motivating, inspiring us to think in new direction. Dhanyawad to each and everyone. Thank you.